Have you ever had this unsettling numbness creeping into your hand, or even tingling, or perhaps a sharp pain shooting down your arm? Well, today we are diving into a straightforward technique that could be your ticket to relief. The method I'm referring to is called nerve gliding or nerve flossing. It's a simple yet effective way to help alleviate the discomfort caused by the irritation or compression, and here's how it works. So think of it this way: the nerves are like strings running through your arm up into your spinal cord. The nerves are long enough to help facilitate any type of movement you really want to do, basically. But sometimes they'll get obstructed by the joints they run by or the tissue they run through. And here's where nerve flossing comes in. Nerve flossing or nerve glides help to free up any restrictions and help the nerve run smoothly through the arm. And this can help reduce your symptoms if the symptoms are caused by these obstructions. So let's say this is a nerve and my hand now is representing tissue or a joint surrounding this nerve. And so gliding it would just meaning moving it back and forth through this tissue, freeing it up from any obstructions. So freeing up this nerve would also help reduce the irritation and symptoms caused by this nerve. Three major nerves run through your arm: the median nerve, the ulnar nerve, and the radial nerve. Let's start with the median nerve, but first of all, let's do a quick little quiz. What is the nickname of the median nerve? Comment your answers below and I will put the answer up at the end of this video. So let's first look at the anatomy of the median nerve.
The median nerve, also known as the labrus nerve, is one of the three major nerves of the elbow. The nerve originates from the union of nerve fibers in the lateral and medial cords of the brachial plexus. It contains nerve fibers from the anterior rami of the fifth cervical to the first thoracic nerve C5 to T1. At the elbow, the median nerve lies medial to the brachial artery, deep to the bicipital aponeurosis, and anterior to brachialis. It leaves the cubital fossa by passing between the two heads of pronator tears. The median nerve enters the hand by passing through the carpal tunnel along with 9 tendons. Just after emerging from carpal tunnel, it divides into lateral and medial divisions.
Alright, so now that we know the pathway of the median nerve, here is how to floss it. So we know that the median nerve runs straight through the carpal tunnel here. So we know if we want to put some stretch on it, we need to go palms up, like saying stop. Also, we know it's running through the ports here at the neck, going under the clavicle into the shoulder. So we want to put some stretch on it by moving our arms this way. So this is a good position to start with our median nerve floss. So now if we want to glide the nerve towards the fingers, my head needs to be in this position because now there's slack in the central area and the nerve can move a bit better towards the fingers because I'm pulling through the wrist. So if we want to go the opposite direction, we need to put slack on my wrist and we need to pull towards the center. So in this direction. So now my head's going the opposite direction of my wrist, so the nerve is pulling or gliding towards the center part. So this is basically how we floss or glide the median nerve, is by going back and forth in this plane, just like this. Bobbing our head back and forth towards it would mean pulling the nerve towards the fingers, and opposite will be pulling the nerve towards the center. So let's take a look at the ulnar nerve's anatomy so we can determine the pathway we need to floss this nerve.
The ulnar nerve, also known as the funny bone, is one of the three major nerves of the elbow. It is one of the branches of the brachial plexus coming from segments C7, C8, and T1. At the elbow, the ulnar nerve passes behind the medial epicondyle of the humerus, where it can be palpated with a finger. The nerve enters the palmar aspect of the hand by passing superficial to the flexor retinaculum and lateral pisiform bone. At the distal border of the retinaculum, the nerve terminates by dividing into its superficial and deep branches.
So what do we need to know about the ulnar nerve? First of all, we know that the nerve runs on this side of the palm. So we know that we need to stretch the palm this way, just like the ulnar nerve. But in this case, the ulnar nerve runs on the back side here of the elbow, not on the front side. So the difference would be that the median nerve we are in this position, and the ulnar nerve we need to be in a flexed position because the nerve runs on this side. So this actually stretches this nerve out. So ideally, the starting position would be like this, and the head towards the palm. This would be pulling the nerve towards the hand. So if we want to move the nerve towards the center, of course, the head needs to bob this way and the arm needs to go this way. So now we are pulling the nerve from the fingers into the spinal cord, and now we are pulling the nerve into the fingers. So this would be the way we floss the ulnar nerve. Up next is the radial nerve. So let's take a look at the anatomy and then we'll see what we need to do to floss it.
The radial nerve is the thickest branch of the brachial plexus and originates from the posterior cord of the plexus. It carries fibers from C5 to T1. In the upper part of the arm, it descends posterolaterally. It descends downwards and laterally between the lateral and medial heads of the triceps muscle, while in contact with the humerus. In the arm, this posterior cord derivative runs between the triceps' long and medial heads before giving branches to the long and lateral heads of the muscle. At the lateral aspect of the humerus, the nerve pierces the lateral intermuscular septum and then travels between the brachialis and brachioradialis at the cubital fossa. In the forearm, the radial nerve's superficial branch descends deep to the brachioradialis. It then crosses the anatomic snuff box distally. This nerve supplies the skin and joints of the dorsal aspect of the hand and lateral 3.5 digits.
Okay, so what we've seen about the radial nerve is that the radial nerve is not on this side, the palm side, like the other two nerves. It's on the other side, so it's on the wrist extensor side. So if you want to pull the nerve towards the fingers, the wrist needs to be flexing the other way. So not this way, but the other way, all right? And so we know that it's going through the triceps, so giving it a bit of a twist would also help out. And then bringing the shoulder back into this position will also help out, because now we're pulling it over the shoulder part here on the front, because the nerve runs through the front bottom side of the shoulder. So this would give it a nice stretch. Now, if you want to go towards the fingers, of course, the head needs to bob towards our wrist like this. This would be the position we start in to start flossing the nerve. So I'm going to slide the nerve from the fingers towards the center. So the head needs to bob the other way and the hand needs to flex the other way. And this is pretty much the way we floss the radial nerve. Okay, so as we are flossing, there are a couple of things you need to keep in mind. First of all, be gentle and don't force the movement. If you feel any pain or discomfort or worsening of your symptoms, stop. And also, if your symptoms persist, it's always a good idea to contact a healthcare professional to take a look at your symptoms. So here's the answer to the quiz we had earlier in the video. The question was, what is the nickname of the median nerve? And the answer is the laborer's nerve. Did you get it right? Did you get it in the comments? I'm going to be checking it out.